Hello and welcome to the special series Preventive Edge, an initiative by Fortis Healthcare in partnership with NDTV. Today's episode is a World Heart Day special, Matters of the Heart. Now, World Heart Day is important because it raises global awareness about cardiovascular diseases, the leading cause of death worldwide, and promotes preventive actions like healthy lifestyle choices, early detection and timely treatment. As cardiovascular disease rise across age groups, today leading experts from Fortis hospitals come together to answer pressing questions from robotic bypass surgery to coronary calcium scoring to sudden cardiac death and valve disease breakthroughs. So let me introduce you to them. We have Dr. Vivek Javli, Chairman of Heart Surgery Council across India. We also have with us Dr. Vinayak Agrawal, Senior Director, Cardiology, Fortis, Gurgaon. We also have Dr. Aparna Jaswal, Director Cardiology, Fortis Escorts Delhi. She's also a rhythm specialist. And we have joining us Dr. Atul Limai, Director Cardiology and TAVI Services, Fortis Mumbai. It's really a pleasure to have all you doctors here today at NDTV. Thank you so much for joining us. I think, Dr. Javli, we should begin with you to start talking about prevention. If you can tell us what tests will alert me to know my risks.
Yeah, we usually don't jump at tests. First, know the patient, whether they have any symptoms, any history of family history of heart disease, have sugar, BP, obesity, are they smokers. If there is any indication that there is a risk, then only we test. If we find that a patient has got some risk factors right from the age of 20, we should begin their annual medical check. But if you suspect that they have risk factors, and beyond 40, of course, we check everybody. Then we usually do the routine gamut, but on top of that, there are certain indicators which should alert you. The bad cholesterol, the LDL, low density lipoproteins, and if the low density lipoproteins are higher than 100, then that's a bad news. Okay. That even seemingly very healthy looking people would end up with a bypass surgery. Secondly, there is something called a lipoprotein A, and also, so there are certain indicators like that which are going to tell you more accurately that the risk is very high. And then we investigate them, usually the echo TMT, but then there is something called as CT scan calcium scoring, which is very low dose radiation. Quickly we will know the calcium score, and if the score is high, then we know that they have got bad plaque load. Even the score is low but not zero, we will have to start them on treatment. Okay. So there are gamut of today tests which can tell you without doing anything invasive that there is a problem, and then we can investigate, go to the accurate root cause and treat them very accurately where we can guarantee quantity and quality of life.
Yeah, I think that's really well explained because, let's going step by step. And again, Dr. Vinayak, if I can come to you, we often hear that Indians get heart disease much earlier than people in the West. Is that true, and why is that?
Yeah, it's absolutely true. See, if you look at a study by Salim Yusuf in 2004, and it was a landmark study done in about 53 countries in about 15,000 patients. It clearly showed that Indians, by and large, get an average age of heart disease is 53 years versus 63 years in the West. And that is something which is, which actually started this whole discussion about why Indians are getting heart disease earlier on as compared to the West. The subsequent, a lot of studies have also proven that. And if we look at our own studies, Trivandrum Heart Study, etc., it clearly tells us that Indians are getting heart attack at a much younger age. Now, there is a catch here. See, India is a young nation. Our average age is about 28 years. 730 million Indians are young, between the age of 15 to 60 years, what we call as a working class. And numerically, that is twice the population of US, right? And you would actually look at these individuals and say these are young guys who are going to get heart attacks, numerically will be in higher percentage. But why are we getting heart attacks at say 35, 30 years of age? A lot of people keep saying that is it because of COVID, which it is not. It is predominantly a lifestyle issue that we are looking at.
Dr. Aparna, I want to ask you again, because we're talking about heart attacks and why younger people are dying, or just per se the number of deaths we have in our country. If you could explain us and our viewers what is SCD, the sudden cardiac death, and also if you could tell us, the second question to you is the difference between heart attack as well as SCD, because there's a lot of confusion. Is it the same, not the same? Yeah.
I think there's a lot of interest today in sudden cardiac death, and we're very glad that we're talking more and more about it because it's time we spoke about it. As the name implies, sudden cardiac death is an unexpected death because of sudden loss of heart function. It's important to understand that it occurs within minutes to an hour of onset of symptoms. Sometimes there may be no warning symptoms. It can happen in individuals who previously had heart disease or may not even know that they have heart disease. But it's important to understand what happens when an individual is having a sudden cardiac death. So we are all aware the heart has a specific way of beating, and when they have sudden cardiac death, the heart goes into what we say an electrical chaos. The heart should beat at a specific time, 60 to 100 beats a minute. But when we have sudden cardiac death, it begins to beat very rapidly, 200 times a minute or even more, as a result of which the vital organs do not get the blood supply, and we have what we call sudden cardiac death. The most important point we need to remember here is that the reason that we have sudden cardiac death more than 90% of the time is because of the blockages in the blood vessels of the heart. And 50% of them who die suddenly were not aware that they had blockages in the blood vessels of the heart. Now coming to the second part of the question as to what is the difference between a heart attack and a sudden cardiac death. They are often interchangeably used, but they are distinct. Heart attack is a problem of the blood vessels of the heart, and sudden cardiac death, as I said, is a problem of the electrical system of the heart. When there is a heart attack, there is sudden blockage of the blood vessel because of a clot with factors which we are aware, and the patient presents with chest discomfort as if an elephant is sitting on your chest wall.
Heaviness, which they say.
Yeah, it's like somebody's just sat here, or a very tight band with this pain radiating to your shoulders, inner side of your arms, sometimes to your jaws, which needs immediate medical attention. That's a heart attack where he clasps his chest. In women it may not be as classical, but in men it's typically classical. While in sudden cardiac death, the individual will feel dizzy, can have very rapid palpitations, or can have a fall. Sudden cardiac death can sometimes be the first manifestation of a heart attack. But clearly, both of them are very distinct. We need to understand them and give due attention to each one of these.
I think thank you so much for explaining that so well. Like you rightly said, there's a lot of confusion, people interchange it. Thank you so much for that. Dr. Limai, Dr. Vinayak did mention that youngsters are dying. Now we see a lot more of them dying. So I want to ask you, further on that. Why is there an increase of youngsters dying at a younger age? Is it because they're having more blockages? And what should we be doing to reduce that risk?
So that's an excellent question. I want to pose it in a sociological context. And see, pre-independence, we were predominantly an agrarian society. What that meant was that you worked in the fields a lot. So there was a lot of exercise going on. And then post-independence, there has been a shift from the villages to the cities. And with that, with industrialization, have come problems of lifestyle. So lifestyle problems mean poor appetite, poor food habits, and poor exercise habits. And I'm not blaming the patients or individuals entirely. I think it has to do with our modern condition. So if you look at yourself, we are commuting easily an hour and a half to work every day.
Yes.
So we are spending about 2 to 3 hours just commuting. So my patients will often tell me there isn't any time to exercise. They're looking for that quick fix. And that quick fix is the food that you get either in your cafeteria, which is not high quality, or the food that you order from outside, which is typically high in saturated fats and high in oily substances. So you have the lifestyle issues of a bad diet accompanied by very poor exercise, and the problems, the modern evils of diabetes, high cholesterol and high blood pressure. And when you compound all of these things together, it is no surprise that we are seeing heart disease at a very early age in our country today.
So definitely youngsters need to be more mindful of what they're eating and make sure that they take out that 1 hour to exercise for themselves. I think which you rightly said, those are very critical. Dr. Javli, now that we've understood the base, we've got the base, I just want to go back to what you had said. When we spoke about prevention, I want to ask you if you can help us understand the value of CT scan coronary calcium score. So what is that? Because it's a technical term.
I'm happy that you asked this question. CT coronary calcium scoring is a new test It's a very low dose CT scan.
Yeah.
It is done very quickly within minutes, and you score the calcium in the coronary arteries, the plaques in the coronary arteries and the calcium in it. And if the score is 0, then that's it, the end of the story, there's no problem. If the score is low, 1 to 99, we say that there are plaques starting and we better think of medicines, but also lifestyle. If the score is 100 to say 400, then we know that there's an intermediate load of the plaques, and definitely lifelong statins, blood thinners, and they have to tighten their lifestyle, and we must keep a watch and annually or 6 monthly check them. I like to check them every 6 monthly. If the score is more than 400, then we know that there are severe blocks. We must investigate them, do a formal angiogram and find out what's happening, how are the blocks, where are the blocks, do they require just stents or bypass, and the whole thing. And more important thing is that people who are young, say below 40, and if they have any risk factors identified, and we know that they should not be taking medicines, though do they need medicines or not need medicines, this distinction can be very easily done by a test like that.
So Dr. Vinayak, Dr. Atul did talk about, lifestyle. That's why I want to ask you, when it comes to prevention, viewers often ask us, what are the few lifestyle changes they can make, which are doable and they should be making?
So lifestyle is your key factor at which you start, when people ask me, how do I prevent certain cardiac death or heart attacks or strokes? It's very simple. Have a better lifestyle. But what does that mean?
Yeah, exactly.
Right? It's almost like a cliched word today that do a lifestyle, but nobody really knows what to do about it. The number one which Dr. Lemay said was that have time for yourself. So time is your new currency. So the number one in that health span achievement is exercise, which is about 150 minutes, as we call it, about half an hour to 40 minutes of moderate to high intensity exercise, age appropriate. So if somebody is 80, even if they're walking 2 kilometers, I'm fine with that. But at least make an effort to walk, go out of your house. Number two is nutrition. Now nutrition, the concept is what we call as the Goldilocks zone, which is neither too less nutrition nor too much of it. The fad which you see today is everybody is into nutraceuticals, pharmaceuticals. Everybody is trying anything which they read up on the social media without any, significant information which is, say validated. And that is actually harming them more than it is helping them. The third is to look at the risk factors that you may be having. For example, suppose your father or mother had a heart attack at a younger age of, say, 40, 45 years of age. Now you become automatically at risk. So genes do matter, right? And you should be looking at your lipid profile at 20 years of age. Some people have what we call as a familial hypercholesterolemia, where they get very high cholesterol levels. And sometimes we actually recommend starting at 12 years of age to look at their lipids so that we can catch them young. Looking at your blood pressure once a year, checking your sugar once a year, starting from the age of, say, 20, 25 years of age. Try every 5 years, look at these things. And the most important in today's, say, youth, I would say, is sleep.
Yes.
With the social media on, people are not sleeping on time. They're not getting up on time. They don't follow what our natural circadian rhythm has. And I think that is contributing immensely to illnesses overall.
Well, that's some really valuable information. On that note, we'll be taking a really short break. Lots more after this break, so stay tuned. I think what I would like to ask you, I know it's a little technical, but what are the latest advances in the treatment of valve diseases? Because this is, again, very critical for our viewers to know, looking at the advancement of science today.
So I'll try to simplify. So you know that for many, many years, the only way to treat or replace valves was through open heart surgery. Dr. Zavadi will recall the first successful aortic valve, surgical aortic valve replacement was done in 1960. It took almost 40 years before the transcatheter aortic valve implantation was done back in 2002. Fast forward 20 years, and today the ability to replace an aortic valve completely through a catheter has really revolutionized the treatment of aortic valve diseases. So in last year and the year following that, there are about 100,000 plus transcatheter aortic valve implantations being done worldwide. So that really is a revolution, because what it means is, it means the ability to non-surgically replace an aortic valve. So your hospital stay, your recovery is much, much faster. In fact, in the West, people are going home sometimes the same day after an aortic valve implantation has been done.
Absolutely. In fact, Dr. Charlie, since we are talking about, the new science, technology, if someone I know or somebody who's gone through a bypass surgery, how do I prevent a second bypass surgery or post-bypass surgery, or even if somebody has gone through a stent? And also if you can quickly tell us a little bit on robotic surgery as well.
If you have had a bypass surgeries or if you had a stents, that means you had severe blocks. Yes. Otherwise, nobody would do that. By bypass surgery, by stent, we make you all right. We clear that. We make the blood come that side. But that's not the end of the story. It's only 50% of the story. Now the ball is in your court, the patient's court. He must tighten his lifestyle, take medicines, take care of himself. How? A, lifestyle tightening, the food, the exercise, as Limay said, the sleep, social health, which is very important, nobody looks at it, proper sunlight, etc., etc. Apart from that, self-monitoring. You have blood pressure, you have diabetes, you can't be running every week to a doctor all your life. So monitoring your sugar, monitoring your blood pressure, monitoring your weight, etc., and making sure that these figures are tightened by yourself, by adjusting
So taking
medicines.
Control of your own health.
Yes, and then the medicines that have been prescribed, they are all for the whole life. And then coming to follow up every 6 months once, making sure that your bypasses or your stents are doing well, their heart muscles are doing well, they have improved, your risk factors are under control, your organ functions are normal, your medicines are not giving any side effects, nothing new is suddenly cropping up like a thyroid, prostate, vitamin deficiency, stuff like that. And then along with that, with this properly screened person, anything that is cropping up will be caught in time, reversed in time. The end game is to live a normal quantity and quality of life. There are advances like the robotics. I must say proudly as an Indian that now across the country we have more than 300 surgical robots. My hospital cluster alone in Bangalore, the Fortis, has got 5 surgical robots. And we do so much. In 1 week we had done almost 30 robotic surgeries in all branches. But even in heart, we are now routinely doing robotically assisted heart surgeries like the valves, the holes, the bypass surgery, where part of it will be done by the robotic assistants.
Okay.
But if you look at India, we have now our own robot. And that is little advanced for the heart system, and we can do better. Give another 2 or 3 years, we might be doing very high number of robotic heart surgeries and other surgeries compared to the rest of the world.
So it's really good to know that there's so much out there, people worry to go to a doctor or a cardiologist, but so much out there. But Dr. Parna, again, this is if a surgery happens, we know about the technology, we know about the science. What can be done or how can we prevent SCD?
So I think whenever we talk of can I prevent SCD, it has 2 verticals to it. The first vertical is an immediate care, that you're seeing something happen, and the second vertical is in the chronic stage of the patient. So if somebody you see in your vicinity, doesn't have to be in a hospital, for any one of us, if you see somebody falling on the ground, it's important to understand, to wake him up, and if the patient doesn't wake up, is not breathing, is to immediately initiate cardiopulmonary resuscitation. A lot of focus today amongst all of us doctors is on teaching everybody cardiopulmonary resuscitation. I think I'll take a minute here, and everybody must understand that whenever we do CPR, the patient should be on a flat ground, the patient is on the floor, is not breathing. The first thing to do is call out for an ambulance, and then clasp your hands, place your hands with your elbows straight on the sternum of the patient and begin to give compressions. The compressions should be effective to have the sternum to move at least 1.5 inches, and they should be 100 to 120 times a minute. So that's as simple as that, what is called cardiopulmonary resuscitation. You don't have to do mouth-to-mouth breathing, just keep giving compressions and wait for help to arrive. So that's the immediate vertical that one needs to engage in when you see somebody collapse on the ground.
Yeah, I think that's important for everyone to know what they can do if there is a risk. Lastly, Dr. Vinayak, I want to quickly ask you, if we talk about genes, if somebody in the family has a strong history of something to do with the heart, what should they be doing as if your parent has it or sibling has it? What should they be doing and what they shouldn't be doing?
I think it's a very important question, something which we face almost every day. you would have parents coming in at 52 years of age, 55 years of age. The children are in the age group of 25, 30 years of age, and they're extremely concerned about their own future, right? And this is something which is far more important to the Indian subset also, because we're seeing heart attacks as young as 25, 30 years of age now in India. Now, the first thing to remember is that there are certain genes which are involved as to why somebody gets a heart disease, including cardiomyopathies where the muscle is involved, including blockages, etc., at an early age, right? And you can't change your genes, right? If you have it, all that you can do is be aware of it very early on, say at 20 years of age, so that you tick all the right boxes right from the beginning. And here I would also like to mention that if you are at risk, now the most important thing not to lose is common sense. A lot of people ask me, which oil should I have? And I always say that if for 3,000 years my ancestors have been having desi ghee or kachi ghani sarson tel or mustard oil, it can't be wrong, right? Yeah. So please stick to that.
Stick to the desi ghee and mustard oil.
Stick to desi ghee and mustard oil. There is nothing wrong with that. Olive oil is more used as a dressing, and it's a lot of these things and concepts are being sold to you. Yeah. Also, there are about 150 diet fads which are available, and they keep changing every few years. So stick to your basics, yeah. and most important is more greens, more colors, more vegetables in your diet, regular exercise of at least 150 minutes a week, be active, be social, sleep well, be happy. Yeah. Keep your stress levels down, and I think that's the key. Yeah, that's the key.
And I'm guessing, I'm sure you would agree to that, I'm guessing no smoking and drinking as well.
Oh, absolutely. Yeah. Absolutely.
Well, it's really been a pleasure to have you all with us today on this special show. That's a wrap on the World Heart Day special. Thank you all so much for joining us on Fortis Presents Preventive Edge Dialogues on Preventive Healthcare, Matters of the Heart in partnership with NDTV. So let's unite for a heart-healthy world, not just by raising awareness about cardiovascular health, but also promoting actions to prevent heart disease, because every heartbeat matters.